So we will discuss about the nitrous oxide. So nitrous oxide is used for the maintenance of anesthesia. Okay, it's used for the maintenance of the anesthesia in the sub-anesthetic concentration for analgesia. For sub in the sub-anesthetic concentration for analgesia. Okay, uses. So for anesthesia, nitrous oxide is commonly used in concentration of around 50 to 66 percentage in oxygen. Okay, uh, in associated with other inhalational or intravenous agents. Okay, for anesthesia, nitrous oxide is commonly used uh, used in concentration of around 50 to 60 percentage in oxygen. Okay, is in associated with other inhalational or intravenous agent. Nitrous oxide cannot be used as the sole anesthetic agent due to lack of potency, but it is useful as a part of combination of drugs since it allows the reduction in dosage of other agent. Okay, it reduces the use of other anesthetic agents dose, so it used only in the combination, not only as a sole anesthetic agent because of lack of potency. Okay, and for anesthesia, nitrous oxide is commonly used in a concentration of around 50 to 66 percentage in oxygen uh, in associated with other inhalational or intravenous agent. Okay, for analgesic purpose, for analgesic purpose without the induction of anesthesia, without induction of the anesthesia, a mixture of nitrous oxide and oxygen containing 50 percentage of each gas, okay, is used for only the for only analgesic purpose. Okay, self administration using a demand valve is popular in obstetric practice. Okay, self administration using a demand valve is used in the obstetric practices for changing painful dressing as an aid to post-operative physiotherapy and in the emergency ambulance. Okay, for analgesia, it use with oxygen is mainly seen with 50 percentage of each gas is oxygen and the nitrous oxide. Okay, is used in self administration in the demand valve is popular in the obstetric practice for changing painful dressing and in aid of post-operative physiotherapy and in the emergency ambulance. Okay, contraindication of the nitrous oxide, so must not be used in patient with an air conditioning air containing closed space. Okay, should not be used in the air containing closed space as the nitrous oxide diffuses into this space with resulting in increase in the pressure. Okay, it should not be used with the patient who have containing closed space, because nitrous oxide will diffuse in that and will produce more pressure. This includes conditions such as pneumothorax, the presence of intracranial air after head injury, entrapped air following a recent underwater dive, then recent intraocular gas injection, or intestinal obstruction. Okay, in all these conditions, nitrous oxide should not be given, like pneumothorax, intracranial air after head injury, then entrapped air following recent underwater dive, then intraocular gas injection, and the intestinal obstruction. Nitrous oxide also increases cerebral blood flow and should be avoided in patients with the or at risk of the raised intracranial pressure. It also increases the cerebral blood flow, so its use is restricted in the high intracranial pressure. Okay, or at risk of the high intracranial pressure. Okay, so what is the side effect of the nitrous oxide? So, hypoxia can occur immediately following the administration of the nitrous oxide. Okay, additional oxygen should always be given for several minutes after stopping the flow of the nitrous oxide. Okay, hypoxia is seen after administration of the immediately after administration of the nitrous oxide. So additional oxygen should be given for several minutes after stoppage of the nitrous oxide. Then exposure to the nitrous oxide for prolonged period, either by continuous or by intermittent administration, may result in the megaloblastic anemia as a result of interference with action of vitamin B12. Okay, prolonged or intermittent action of the nitrous oxide will produce the megaloblastic anemia because it interfere with the action of the vitamin B12. Okay, neurological toxic effect can occur without preceding overt hematological changes. Okay, neurological toxic effect occur without preceding overt hematological changes. Okay, depression of white cell formation may also occur. Okay, neurologic toxic effect can occur without preceding overt hematological changes. Okay, neurological toxic effect will there, and the depression of the white cell formation, depression of the white cell WBC formation may also occur. Okay, so this was the nitrous oxide. Then we will see the propofol. So propofol is a short-acting drug with a rapid onset and a rapid recovery with less hangover effect than the other intravenous anesthetics. Okay, propofol is a short-acting drug with rapid onset, short acting with rapid onset and a rapid recovery with less hangover effect than the other intravenous anesthetics. Okay, short acting, rapid onset, rapid recovery, and the less hangover effect. Okay, it produces hypotension and respiratory depression. It produces the hypotension and the respiratory depression. Okay, it produces the hypotension and the respiratory depression to a greater extent than other intravenous anesthetic agent. Okay, it produces the hypotension and the hypotension and respiratory depression to a greater extent. Okay, uses. So propofol is the most widely used intravenous anesthetic in the UK. Okay, it can be used for induction or maintenance of anesthesia in adult and in the children. Okay, propofol is the most widely used intravenous anesthetic. Okay, uh, okay, intravenous anesthesia. Okay, it can be used for induction and maintenance of the anesthesia in adults and children. It can be used for the induction or in the maintenance of the anesthesia in adult and children. Okay, but it is not generally used in the neonate. It not be used in the neonate. Okay, it can also be used for the sedation during the procedure. Sedation for adults in intensive care. Propofol reduces airway and pharyngeal reflexes. Okay, propofol reduces airway reflex and the pharyngeal reflex. Therefore, it is the ideal drug to use with the laryngeal mask airway. Okay, it can be used. It's an ideal anesthetic because it reduces the uh, airway and the pharyngeal reflex, so it's used is ideal for the laryngeal mask airway. Okay, and it can be used in the induction or maintenance and of anesthesia in the adult and children. Its use is generally contraindicated in the neonates. Okay, administration. So the induction dose in an unpremedicated young adult is 2 to 2.5 milligram per kg. Okay, uh, in young adult it is 2 to 2.5 milligram per kg body weight. Okay, as an induction dose. Okay, premedication with opioid or benzodiazepine markedly reduces the dose of propofol needed to induce anesthesia. Okay, premedication, it's used in unpremedication In the young adult, it's 2 to 2.5 milligram per kg body weight, and in the pre-medicated patient with opioid and benzodiazepine, its dose is mildly reduced. Okay, elderly patient needed a smaller dose, whereas children needed a larger dose. Okay, it's the opposite. Like elderly patient need small dose, and while the children will need the large dose. Okay. After induction with propofol, anesthesia can be administered in one of two way. Okay, after induction with the propofol, anesthesia can be maintained in one of two way, using a volatile inhalational agent or using a infusion of propofol. Okay, the maintenance of the anesthesia can be given after induction by the propofol, maybe given in the volatile inhalational agent or by the infusion of the propofol. What is the pharmacokinetics? So when a single induction dose of 2 milligram per kg is injected, there is a rapid rise in the blood level of the propofol, and loss of consciousness occurs within 20 to 40 seconds. Okay, when this dose is injected, rapid rise in the blood level of the propofol and loss of consciousness occur in 20 to 40 seconds. Okay, clinically, this will be manifest by loss of verbal contact. Okay, manifested by the loss of verbal contact with the patient. Okay, blood level peak around 90 to 100 seconds. Okay, blood level then rapidly decline due to the redistribution and elimination of the propofol. The distribution half-life of the propofol is 2 to 8 minutes, and elimination of the half-life can be up to 6 hours. Return of consciousness occur within 20 minutes. Okay, elimination half duration of action of propofol will in 2 to 8 minutes, and the patient can regain consciousness in 10 minutes. Okay, and the elimination of half-life is around 6 hours. Okay, propofol is very rapidly cleared from the blood, and has a clearance rate of 1.5 to 2.2 liter per minute. Okay, it is rapidly metabolized in the liver. There are two metabolic pathway involved: conjugation of glucuronide, conjugation to glucuronide, and the hydroxylation to quinol. Okay, which is subsequently glucuronidated. Okay, clearance of the propofol from the plasma is greater than would be expected if it were only metabolized in the liver. Therefore, there are probably extrahepatic sites of its metabolism. Less than 1% of dose is excreted unchanged by the kidneys. Okay, so propofol is very rapidly cleared from the blood, and has the clearance rate of 1.5 to 2.2 liter per minute. Okay, it is rapidly metabolized in the liver, and there are two metabolic pathways involved: conjugation to glucuronide and the hydroxylation to quinol, which is subsequently glucuronidated. Okay, clearance of propofol from the plasma is clearance from the plasma is greater than would be expected if it were only metabolized in the liver. Therefore, there are probably extrahepatic sites of its metabolism. Less than 1% of dose is excreted unchanged by the kidney. Then pharmacodynamics. So, central nervous system, cardiovascular system, and the respiratory system. So, in the CNS, it causes sedation, loss of consciousness, and the anesthesia. Then, antiemetic effect, reduced cerebral metabolism, and blood flow with consequent reduction in intracranial pressure. Okay, reduced cerebral metabolism and blood flow with a consequent reduction in the intracranial pressure and cerebral perfusion pressure, reduced intraocular pressure. Okay, so what effect of the propofol on the CNS? So it causes sedation, loss of consciousness, and the anesthesia, antiemetic effect, then reduced cerebral metabolism and blood flow with the consequent decrease in the uh, cerebral cerebral perfusion and the intracranial pressure, and it also reduces the intraocular pressure. Then the cardiovascular system, so it causes reduced systolic, diastolic, and mean blood pressure due to vasodilatation and reduction in the pre and after load. So it reduces the systolic, diastolic, and the mean blood pressure due to vasodilatation and the reduction in the pre and after load. Slightly negative inotropic effect, and the heart rate remains mostly unchanged. Okay, it causes the inotropic effect, negative inotropic effect, and heart rate remain unchanged. On the respiratory system, reduce the tidal volume and respiratory rate, producing respiratory depression. Okay, decrease the tidal volume. Okay, tidal volume will be decreased in the respiratory rate, producing respiratory depression, and decrease the respiratory rate, so it causes the respiratory depression. Okay, uh, decreases the tidal volume and the respiratory rate. Okay, decrease ventilatory response to carbon dioxide. Okay, and the reduced upper airway reflexes. Okay, so what's the question should be taken? So in hypotensive state, the blood flow to fat and muscle is reduced. Okay, blood flow to the fat and muscle is reduced in the hypotensive patients. Thus the volume of distribution is reduced in patients with will be more sensitive to the effect of propofol. So volume of distribution is reduced and the patient will be more sensitive to the effect of propofol. Okay, propofol itself can produce hypotension, and great caution must be exercised in giving propofol to hypotensive patient. If a patient is in a stable state of shock, it is advised not to use propofol for the induction of the anesthesia. Okay, in the shock, propofol should not be used. Then what are the side effects? So possible side effects include hypotension, bradycardia, tachycardia, arrhythmia, then the pruritus or rash, nausea, vomiting, pain on injection, excitation phenomenon such as involuntary movement, headache, transient apnea. Okay, these are the side effects like hypotension, bradycardia, tachycardia, or arrhythmias, then the pruritus or rash, nausea and vomiting, pain on injection, involuntary muscle movement, headache, and transient apnea. And propofol infusion syndrome. Okay, propofol infusion syndrome, that's a propofol infusion of prolonged infusion of the propofol doses exceeding 4 milligram per kg per hour may result in the potentially fatal effect, including metabolic acidosis, arrhythmia, cardiac failure, rhabdomyolysis, hyperlipidemia, hyperkalemia, hepatomegaly, and the renal failure. Okay, propofol infusion syndrome, when the prolonged infusion of the propofol exceeding 4 milligram per kg per hour may be fatal. Okay, because it causes the metabolic acidosis, then the arrhythmia, cardiac failure, rhabdomyolysis, hyperlipidemia, hyperkalemia, hepatomegaly, and the renal failure. Okay, so this was the propofol. And the last one is the thiopental sword. So the thiopental sodium. Thiopental sodium is a barbiturate, was the most commonly used intravenous induction agent until the introduction of the propofol. Okay, it was the mostly used intravenous induction agent before the introduction of the propofol. It is still commonly used in the UK and is the preferred drug for rapid sequence induction of the anesthesia. Induction is generally smooth and rapid, but the dose-related cardiovascular and respiratory depression can occur. Okay, recovery after a single dose is rapid due to redistribution. However, metabolism is slow, and sedative effect can persist for around 24 hours. Repeated dose have a cumulative effect, and recovery is much slower. So, Thiopental sword, okay, it is the barbiturate, okay, and was most commonly used as a intravenous induction until the introduction of the propofol. It is still commonly used in the UK and preferred drug for the rapid sequence induction and the anesthesia. Rapid sequence induction of the anesthesia. So, induction is generally smooth and rapid, but dose-related cardiovascular and the respiratory depression can occur. Recovery after single dose is rapid due to distribution. However, metabolism is slow and sedative effect can be persist for 24 hours. Okay, repeated dose have a cumulative effect and the recovery is much slower. Now, administration. So, the induction dose for thiopental for healthy young adult is 4 to 5 minutes per kg body weight. Okay, induction dose for the thiopental for a healthy young adult is induction dose for healthy young adult is around 4 to 5 minutes. Okay, okay, 4 to 5 milligram per kg. Okay, it's the induction dose for the healthy young adult. Thiopental is prepared as 2.5 percentage solution. Okay, it's prepared as a 2.5% solution. The recommended induction dose should be given over a period of about 20 seconds. Okay, recommended induction dose should be given over a period of 20 seconds. If the thiopental is injected more rapidly, the onset of anesthesia is quicker and the cardiovascular and the respiratory depression will at the higher side. Okay, so the administration, so the for the induction dose, the thiopental sodium is used for the healthy young of around 4 to 5 milligram per kg. Then thiopental prepared as a 2.5% solution and is given for about 20 seconds. Okay, if more fast injection is given, then it's causes the more rapid cardiovascular and the respiratory depression effect. Okay, reduced dose may be required in the condition associated with the low plasma protein such as malnutrition, chronic renal failure and the cirrhosis, the elderly and the hypothyroid patient. Okay, reduced dose is required in the low plasma protein like malnutrition, chronic renal failure and the cirrhosis in the elderly and the hypothyroidism. An increased dose may be required in the children. Okay, chronic alcohol abuse and long-term treatment with drug that induce the cytochrome P450 enzyme system in the liver. Okay, it's high doses required in the children and the chronic alcohol abuse. Okay, what is the pharmacokinetic? So, after a single induction dose of around 4 milligram per kg, there is a rapid rise in the plasma level thiopental. Okay, there will be rapid rise. In the plasma level, the plasma level peak at around 90 to 100 second, and the decrease rapidly due to redistribution. Redistribution occurs quickly to the vessel rich group. Okay, redistribution will occur in the vessel rich group like the liver, kidney, and the brain of tissue, then the muscle and fat. Okay, redistribution will occur in the liver, kidney, and brain. The level of muscle peak at around 20 minutes, and the fat at around 45 minutes. Loss of consciousness occur in around 30 seconds. Okay, one brain circulation time, and return to consciousness within 10 minutes. Okay, thiopental is metabolized only very slowly, and metabolism play no part in the return of the consciousness. Okay, it metabolism occur very slowly. Okay, metabolism of thiopental occurs in the liver. Okay, it is mainly broken down into inactive carboxylic acid analogs. Okay, which are excreted by the kidneys. Okay, it mainly broken down into the inactive carboxylic acid analog. Okay, which are excreted by the kidney. Okay, a small fraction of the thiopental undergo desulfuration. Okay, to pentobar pentobarbital, which is a long acting hypnotic. The distribution half-life is 2 to 8 minutes, and elimination half-life is about 10 hours. Okay, thiopental is metabolized only in very slow, only very slow, metabolized very slow, and metabolism occur in the liver. It mainly broken down in the inactive carboxylic acid analog. Okay, in the and it excreted by the kidney. A small fraction of thiopental undergoes disulfuration to pentobarbital, which is a long acting hypnotic. The distribution half-life is 2 to 8 minutes, and elimination half-life is 10 hours. Okay, then pharmacodynamics. So central nervous system, cardiovascular effect, and the respiratory effect. Okay, so central nervous system, loss of consciousness and the anesthesia, reduced central cerebral metabolism, with a consequent reduction in the central cerebral blood flow, and the intracranial pressure will be reduced. Okay, anticonvulsant effect, and the reduced intraocular pressure. Okay, same as the albuterol, sorry, same as the propofol. Okay, then the cardiovascular effect, so reduced systolic, diastolic, and mean blood pressure, same as that, with okay, heart rate may increase slightly at induction. This is the different thing. Heart rate will be increased. Then respiratory effect. So reduced respiratory rate and tidal volume. Okay, same as the propofol. Sensitized laryngeal and pharyngeal reflex. Sensitized laryngeal and pharyngeal reflex may result in the laryngospasm in response to surgical stimulation. Okay, presence of secretion or insertion of the oral airway or laryngeal mask as to light plane of anesthesia. Okay, it's different from the propofol, and decreased ventilatory response to hypoxia can precipitate bronchospasm in susceptible patient. Okay, it will cause the bronchospasm. It's also different from the propofol. What's the question? So barbiturate induce hepatic enzyme gamma amino levulinic acid synthesis, which produce the porphyrins, can be induced, and in susceptible patients, an attack of acute intermittent porphyria can occur. Okay, acute intermittent porphyria can occur. Thiopental is absolutely contraindicated in this patient. Okay, barbiturate induces the hepatic enzyme. Okay, side effect. So, extravasation of the thiopental during the injection can lead to tissue damage. Extravasation can lead to tissue damage. Then the accidental intraarterial injection causes the vasospasm and may lead to thrombosis and tissue necrosis. Okay. Then involuntary muscle movement on induction, cough and laryngospasm, arrhythmia, hypotension, headache, and hypersensitivity reaction. Okay, side effects are the it causes the tissue damage if extravasated. Okay, and accidental intraarterial injection cause the vasospasm, causing the thrombosis and the tissue necrosis. Okay, involuntary muscle movement during the induction, then the cough and the laryngospasm, arrhythmia, hypertension, headache, and the hypersensitivity reaction will occur.